Hello everyone, today we are going to learn about the EEG lead placement and the different types of montages used in the EEG reading. The goal of lead placement is to make the conduction of electrical current from scalp to machine as accurate as possible. First of all, scrubbing the scalp at the electrode site with a pumice-laced detergent is done, which lightly abrades the skin and removes oil from the surface of the skin. Then a conductive gel containing salts in a viscous medium is applied so that ions can carry current between electrodes and the skin. Electrodes are held in place with tapes and the viscosity gel. At some centers, electrode systems are attached with the help of specially designed caps that have channels for fixing electrodes are used. When patients require a long-term electrode placement, then they are glued in place with collodion, which is a flammable compound related to gunpowder that requires ether or acetone for its removal. Besides normal conditions, it is very important to note the local findings like scalp edema, subdural hematomas or hygromas, and burr holes that significantly alter the EEG signals. International 1020 system. The placement of electrodes on the scalp is based on the International 1020 system. There are 4 cardinal points that are mostly used during this system from head anatomy. The nasion is the indentation of the nose between the eyes. The inion is the midline occipital protuberance. The left and right preauricular points are indentations just anterior to the ear. These points determine the sagittal and coronal midlines. 1020 refers to the percentage of length determined from 2 midlines. By using measuring tape, nasion and inion distance are measured in centimeters. Similarly, both preauricular distance is measured. Then suppose the distance between 2 points is 20 centimeters, then it is taken as 100%. And with the help of measuring tape through nasion to inion 50% is marked, and that point is the vertex. It is also marked through preauricular measurement. It is labeled as CZ. Montages. There are various types of montages, like bipolar, common electrode reference, average reference, and Laplacian montages. How are the EEG leads are arranged? Whether it is anterior-posterior bipolar montages, transverse bipolar montages, or average referencing montages. They are arranged in such a way that it gives us the functional images of the brain. In anterior-posterior bipolar montage, we can see the sagittal and parasagittal functional images of the brain. The images are arranged in a sequential format, like from the left temporal, left parasagittal sequence, central sequence, right parasagittal sequence, and finally the right temporal sequence. In each sequences, the leads are arranged in the anterior, which is the frontal region, to the posterior or the occipital region. In transverse bipolar montage, we get the coronal functional images of the brain. In this transverse bipolar sequences, we get the frontal, tempoparietal, to occipital sequences. Common reference montages compare signal at every electrode position in the head to a single common reference. One of the most common references is CZ, in which every electrode is compared to CZ. This type of montage starts with left temporal, then left parasagittal, then midline, then right parasagittal, and right temporal. Common average reference montage compare the signal at each position in the head to the average of the rest of the head. In this montage, it compares F7 to signal everywhere else, as FP1 and FP2 are very susceptible to eye movement artifacts, and also O1 and Oz are susceptible to head movement artifacts and hence are excluded. Laplacian montage is probably used least as it is difficult to conceptualize this montage. In this montage, it compares C2 to the 4 closest neighbors.